Welcome to Health Matters. I'm Dr. Derrick DeSilva. Multiple sclerosis can affect nearly every avenue of a person's health. The lifelong disease is an everyday battle with massive highs and lows. Although there's no cure for multiple sclerosis, there are many ways to treat it, beginning with lifestyle change. Evan Chait is here today. He's the president of Kinetic PT and AccuWellness, and he's here with one of his patients, 27-year-old Nick Urbina, who's living with multiple sclerosis. So, by the way, welcome. Thank you for joining me.
Thank you.
Evan, let's start with you. Multiple sclerosis, what is it?
It's an autoimmune disease that affects the nervous system.
So it's a disease that the body starts to attack itself?
Correct. The body starts attacking itself, and eventually you start losing your ability to function.
Nick, when were you diagnosed?
I was diagnosed in November of 2009.
So you've had this for a little while.
Yeah, coming on 10 years, yes.
What have you tried? What have you done?
Well, I met Evan. He's helped me out with my diet, acupuncture, physical therapy. So I've come a long way thanks to Evan.
So talk to me about the lifestyle changes you've made with Nick.
So the first thing we started with was Nick's diet. Because when Nick started with us, he was in a wheelchair. He couldn't even speak at that point.
Oh.
And so we first had to start with his diet and lifestyle. That's the first place. And then as he started gaining more strength, we started doing the acupuncture on him. Then he's able to start moving a little bit more. We started the physical therapy. Then over time, he's built up strength. Now he works out. How often do you work out now?
At the clinic, twice a week.
Twice a week. And now he has a full-time job with us.
Excellent.
He's actually a superhero.
Excellent. You know, getting out of a wheelchair or crutches with multiple sclerosis is quite a feat. You know, when did that happen? How long did that take, Nick?
I was in the wheelchair for 3 years.
And then after you started your therapy with Evan, with the lifestyle and everything, how long did it take for you to really start seeing it, making progress?
I started seeing little improvements like around 2012-ish, and then I just never stopped.
Wow. So you're still continuing to improve?
Yeah, it's an everyday battle, yeah.
What has been the most dramatic change with you?
I mean, I think getting up out of the wheelchair is the biggest thing that I've done, and I just want to continue that. Every day make a new stride.
Very quickly, Evan, what do you think that's been attributed to? What do you think the number 1 and 2 thing that has made a difference?
His mindset. I think his mindset is incredible. He's so positive. I think that's number 1. You need to be in the right headspace. Number 2 is you need to have the right coaching team or a team that's going to be able to help you.
Excellent. Well, thank you so much for joining us. Keep up the good work.
Thank you.
Great to have you here. Thank you very much for joining us. Folks, if you have any health questions you'd like to ask, head over to my Facebook page and you can post your question there. Once again, thank you so much for spending some time with us here today. Here's a look at this week's Community Health Calendar.